tilt at the hip, which many people don't know how to do. They bend at the waist instead of tilting at the hip. Right. Yeah. So it takes concentration to make the difference between the two. But you're absolutely right. And when you're not breathing from the diaphragm, you're overusing the secondary breathing muscles like the scalenes.
Yeah.
So those get very tight. And again, it's just goes on, and you're just in a bad situation that you need to get out of.
Lauriann, from your experience, what do you see, or what do you see most often with therapists? You talked about ulnar pain, and I actually had ulnar.
That was me. Yeah. I had ulnar tendinosis on both hands. Radial is actually more common. But there's any number of
what are the top three?
The top three. Nerve compression injuries in the neck and arm that may or may not turn into carpal tunnel syndrome. Carpal tunnel syndrome is not that common among massage therapists. You can get pain and paresthesias in some of the fingers that are innervated by the median nerve, but actual real carpal tunnel, unless you have been doing other things or you're pregnant. People who are pregnant tend to get carpal tunnel out of nowhere because of a buildup of edema. But I would say neck pain and low back pain. People bend, again, they bend at the waist, but even if they're bending at the hips, they bend over too much. Think about the way I was taught to do, the opening effleurage, to spread the oil on the back is to stand at somebody's head, put the oil on your hands, and go all the way down to their, ilium, and then come back up. Now you have to, especially if you're short, you have to bend over quite a bit to do that. If you do that all day, in ergonomic terms, if you're bending consistently more than 20% of an angle, a 20% angle, which is like that, that is a risk factor for injury. So, so you end up with low back pain simply from doing too much bending over. They bend down to get, maybe their hot stone machine is on, a lower level. So they're bending to get the hot stones or, something from a hydroculator or, that's where you start getting into setting up your workspace to be ergonomic. So you don't have to be bending. So things are, in a good position for your body. But certainly a lot of the movements that are sort of basic that we learn, in the first few weeks of massage school, at least I did, involved a lot of bending over. So the neck problems come quite a bit from the fact that the head is about the weight of a bowling ball, 10 to 12 pounds. And people are looking down at their clients as they work all day long. Instead of learning to trust their palpation skills. Again, this is more common among people who are just starting out the first few years until they realize that they don't have to be, you actually see more in your peripheral vision. You see better and you sense things better than if you're actually just staring at somebody.